Welcome back to continue our discussion talking about social determinants of health and adverse childhood effects, part 2. Joining me again is Dr. Robert Block, chairperson of the Department of Pediatrics at the University of Oklahoma School of Community Medicine. I call you chairperson this time.
That'll work.
Let's jump in. Now, we were talking about before the break, looking at temper tantrums versus angry, violent behavior. Now, in looking at the brain changes that can occur because of these stressors or these events that have happened, and they're being able to show that, could the angry, violent behavior, you talked about mental illness, could that be affected by those kind of experiences? Because you talked about changes in the brain. So could that possibly be a signal that there has been some change in the brain that you may be able to roll back to these other experiences?
Well, it can. Brains are set to develop in an environment of having needs met. Human babies can't meet many or any of their own needs, so their brain is expecting that when they cry, somebody will find out what's wrong. If they're hungry, they'll feed them. If they're wet, they'll change them. If they're just upset, that they'll soothe them. If that doesn't happen, if a baby is ignored and neglected, then the baby's brain, instead of developing to, gee, life is on my side, I can trust other people and go to them for help, the baby starts learning in a figurative sense, I'm always going to be looking over my shoulder to see who's after me now. Nobody's here to protect me, therefore I have to protect myself. And you might be reaching out to me in a helpful gesture, and I might see that as an assault if I'm a 3 or 4-year-old child, and I'm going to react to that. Now, children are born with different temperaments. We know that some children are very easy, they adjust to new situations, they're friendly with lots of different people, although all babies go through a little stranger anxiety. Right. Other babies are born very standoffish, and they don't sort of meld into your body when you cuddle them. They don't like new situations. We're not talking about that, which is present in a variable range among all babies. We're talking about extremes of emotions where children are either extraordinarily withdrawn and won't interact with anybody, some of whom now get diagnosed as being autistic, all the way to the range of children who are raging and fearful, and the world is for some reason not fair to them, also sometimes diagnosed with mental illness diagnoses. That has to be sorted out, because some of these children, for reasons we don't understand, do have a mental illness that needs to be dealt with. But I think many more are perhaps exhibiting signs, later in childhood, or even beyond primary school. They're in middle school, they're having difficulties, and we're scratching our heads saying, why is this child doing this? Doesn't make any sense. If we learn to go back and see, now that gets a little invasive with families and with children themselves and with their parents. But if we can approach it intellectually, with honesty and with dignity and with respect for individuals, and say, I need to know more about your past history, that can help us. And that's brand new, I think, to the science of medicine, where we've always wanted social workers and psychologists to sort of delve into that area. It's now something that's important for pediatricians and any primary care provider who's taking care of children.
Okay, I'm going to roll into the other years in terms of middle and high school in just a moment. But I do want to ask this question, because you talked about the temper tantrums once again and sort of normal development. For caregivers or persons just involved with children, how can they kind of know whether this temper tantrum is more developmentally appropriate versus, because our perceptions can be different. What I may see as a temper tantrum, someone else may see as extreme rage. So how are we to know if it's developmentally appropriate, or maybe there's a little bit more here?
Well, that's a very good question, and if we had a 4-hour show, I could probably answer it.
I know.
But basically, I think that children around the age of 18 months to 3, to give a range, don't have a good capacity to talk things through because they don't have very good language skills yet. And they get angry about things, and so they'll stomp their feet. Some kids are pretty good at being histrionic, and they'll jump up and down, and they'll turn red in the face. Some children hold their breath and scare the heck out of everybody.
Some people pass out, little kids will pass out.
But it's manageable with a little calm parenting and a little timeout or a little reassurance, or sometimes just ignoring the whole show and going somewhere else and letting it play itself out. It resolves. That's all within the range of normal. Bothersome, but within the range of normal. What we're talking about when we're talking about rage that's beyond that is it's unmanageable. It can go on for long periods of time, and any attempt to interfere or intervene physically with the child, to reach out, to hold them, they'll react even more violently too, and people can get injured, even by young children.
Okay.
It's a dangerous situation because you don't know whether to leave them alone or whether to try and grab them, and that's another show about how you react to that. But the rage we're talking about, and the other form of that, which is total withdrawal. I'm not going to talk to you no matter what you do. I'm not going to look at you. I'm just going to be in my own little world.
Okay.
Either of those extremes is quite often something that we're seeing in reaction to how the brain was formed during early development.
Okay.
And perhaps knowing that can lead to ways we can do counseling and therapy with these kids to help them become more I don't want to use the word normal, but become easier for them to walk their way through life.
A little more socialized, yes, for their advantage. And that's really good to know, because if parents, like I said, or caregivers or people involved with kids really cannot console them or kind of intervene in a way that helps get them through it, then you might be talking about something a little bit deeper, where you need to look and talk with your pediatrician. And
right, and none of it's just once or twice over a period of time, so that people don't get too worried. But if this is every time the child gets angry, he's totally lost and strikes out and is violent, if that's going on, parents have to sort of, I guess, take into account there's something happening then, or that happened in the early life of this child. I might have been involved in that, maybe not, but I have to bring this to my pediatrician or to a therapist or to somebody to say, let's explore, because that will give me a way towards better health in the near future.
Okay. Let me ask this really quickly, and then I'm going to go to break. Sometimes parents' normal reaction will be, let's go send them to a boot camp. Let's go send them to something where they can control this by discipline. It doesn't sound like that is the primary or the first approach we should use necessarily.
It's a good approach, but not the first approach.
But not the first approach before exploring other things. Right. Okay, we're going to take a really quick break and come back and talk about what do we need to do in terms of educating our kids in schools and helping them to get the quality education that they deserve. Okay? Please stay with us. We'll be right back.